Hi, it's Dr. Bette Robin with the Dentistry Rising podcast. You might know me as a dental practice sale broker from Orange County, California. I am a dentist as well as an attorney and broker, and it's my goal at this point to help you get where you want to go with your practices, to help inspire you, lead you in the right direction, and motivate you. So happy listening. Hi, you guys. Happy January. In last week's Straight Talk episode number 63, we talked about what I called the top 3 things to focus on when looking for a practice to buy. And in review, they are profitability, right price, right terms, right transition, and third, the right fit for you. If you didn't listen to that episode, you probably should go back and listen to it so that you understand this episode. So during that episode, we talked about the fact that percentages often work, like 80% of the last year's collections or 85% or whatever it is. And I said there's a whole other laundry list of things you need to be concerned about other than profitability. So we're going to talk about this laundry list today, or at least some of the items on it. And this laundry list really cannot be ignored. Otherwise, you will have a distorted view on valuing a practice. So the most important items on this laundry list are as follows, at least in my opinion. Number 1, employee salaries. The employee salaries are the single biggest expense item that you have. So in order for you to be able to take something home, your employee salaries have to be within reason, which ideally is less than 25% of your collections. Now, some of you may go up to 30%, especially here in Southern California, but watch this percentage because otherwise you'll end up taking home less than your employees. So again, 25% is the number I'd like to see in the ideal number. A lot of other things to consider with employees as well. Are most of them at least staying with the practice? That's really important. That's a big part of the goodwill that you're buying. Now, it isn't unusual to have an employee or maybe even 2 that want to retire with the doctor. Employees that have been with the practice 30 years or more, sometimes that just happens. But most of the employees should be staying with the practice and willing to be on board to help you go forward and do well. Number 2, the lease. Now, the lease should ideally be less than 7% of your last year's collections. Again, that can be hard to do in Southern California, so I'd say 10% is really my cutoff. The lease needs to be appropriate. Again, or if it isn't, again, all your money can get eaten up. All your profit or your salary can get eaten up by giving it to other people like your landlord. Lots of other issues with lease, which we're not going to totally go into, but certainly want to be sure your lease can be renewed at least approximately the same terms as the selling doctor has. Now, lease renewal is usually not an issue at all in a professional building, but it can be a big issue in a retail center because sometimes a Starbucks kind of store is much more profitable to a center owner. So you've got to pay attention to your lease. I always say that the lease document itself is a lot more important than the sales agreement because you live with that lease document day in and day out. Whereas the sales agreement's kind of one and done. And if you don't have problems, and hopefully you don't, but that lease will follow you till the day you sell your practice. Okay, number 3, look at individual provider productivity. Usually that's hygienists, and I'm here talking about, in general dental practices. So look to see how much a hygienist was paid by looking at their W-2 or 1099, not an estimate, the actual document, and make sure they're producing at least 3 times what they're paid. So you're going to look at their W-2 or 1099, let's say for 2019, since we're right now in early 2020, and you're going to compare that to or look for the same period of time, the 2019 Provider Productivity Report, to see what that hygienist produced. And again, you want that to be 3 times. They will need to produce 3 times what they're paid. It can be really hard to change how a hygienist practices. So don't fall in the trap of thinking you'll add a soft tissue management service or you'll start selling Arrestin or whatever to get that number up, because it really rarely happens, at least with current hygienists, because they do things the way they do things, and they are a big part of the goodwill you're buying. Now, this is different if you have an HMO practice and all the hygiene services are zero, etc. So I'm talking PPO or private practices. HMOs, it's trickier. Generally, the HMO kind of hygienists are paid less and or selling a whole lot of dentistry for you. But it's different. So always do that analysis so you can at least know what is. And fourth, are you comfortable with the insurance composition of the practice? I'm always kind of amazed when I show a buyer practice that's primarily PPO, which is what the majority of them are, at least that I deal with as a broker. And the person wants to, add HMOs, add Denti-Cal, or go the other way, get rid of all the PPOs and make it a completely private practice. These are different animals. So I think you need to I say 80, 90% of the practice characteristics that you're buying. And if you don't like the insurance composition, that's the patient population. And that's what you're spending a lot of money for, the patients, which compose the goodwill. So if you want an HMO practice, entirely different game, entirely different patient base, and you should buy an HMO practice. And I think the same thing goes for if you want an entirely private practice. Different kind of patients, different expectations from the patients, different financial policies, and it's just a hard transition. I'm not saying either one is impossible, but buy what you like. I mean, you wouldn't buy a Porsche if you really want the Mercedes. I mean, it's kind of the same thing. You're buying an entirely different animal. So those to me are the most important items in the laundry list. And there's a lot of others. Some of them, are not as important as these. But for these 4, I think you really need to be aware of. So they are, again, employee salaries less than 30%. Number 2, lease less than 10%, ideally 7%. Individual producers like hygienists producing about 3 times what they're paid. And you're comfortable with the insurance composition of the practice. It's what you want. It's the kind of patients you want to practice on. Okay, so that's all I have for you right now, and I hope it helps helps you find a practice and decide on a practice that you like. Thank you. Dr. Bette Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.